in joining us. I think some of you were on our last panel.
Welcome to Fox 26's Town Hall. Your voice, your future. Fighting Fentanyl. Sponsored by Dr. Ignacio Guzman, Choose Change California, West Care California, and Sierra Meadows Behavioral Health. Moderating tonight's broadcast, Fox 26 news anchor Liz Gonzalez.
It's a conversation Fox 26 News began last June.
We denied that there was even a problem, and it snuck up on us, and it punched us right in the face, and it knocked us down.
So the system is broken, and the penalties are nothing.
Over a problem that continues to thrive, with lives at stake.
Exemplary pills are pretty much like playing Russian roulette.
Almost every child out there knows somebody that is using something. Most of their friends are at least experimenting. Kids experiment, but today experimentation is going to kill them.
I'd rather die from an overdose than have to go through withdrawals because it's that bad.
I begged him to get into treatment, to get into therapy. He said, I got this, Mom. And 10 months later, he was gone.
Making this a mission worth continuing.
It's time for parents to wake up.
Well, good evening and welcome to the Fox 26 Town Hall, Your Voice, Your Future, Fighting Fentanyl 2023 Challenges. I'm Liz Gonzalez. We are coming to you live here from the Fresno Missions City Center in Central Fresno. We certainly want to thank the Fresno Mission for allowing us to use this facility in this venue. Fox 26 news anchor Monty Torres is in our studio fielding questions and comments from you, our viewers. Monty?
Thank you, Liz, and good evening to all. We invite all of our viewers to be part of our conversation tonight by sending us your questions. You can do that by sending those our way at newsdesk@kmph.com or through our Fox 26 Facebook page. Liz?
All right, thanks so much, Monty. We're going to be checking in with you in just a few minutes. We also want to thank some wonderful sponsors who are making tonight's town hall possible. Our sponsors tonight, Dr. Ignacio Guzman, the California Department of Healthcare Services, Sierra Meadows Behavioral Health, and West Care, California, for bringing you tonight's town hall. So we certainly thank them. Now, here's an overview of just where we plan to take you over the course of the next hour. We want to talk about where are we now? Is law enforcement able to make any progress on this issue? How is Sacramento impacting the fight against fentanyl? And how is enforcement affected by laws on the books? We're also going to talk about the challenges to receiving care and when it's time to reach out for help. This also includes decoding some of the ways that fentanyl is being marketed to our youth. And we'll also look ahead at drugs that are threatening to be the next big thing, that seriously poses a threat to society. Our panel of experts is joining us tonight to provide their insight and their unique perspective on this very important issue. Tim Ward is the district attorney for Tulare County. He has been with the DA's office in Tulare County since 1999 and is the president of the California District Attorneys Association. Flint Anderson is the founder of the nonprofit PAIN, which stands for Parents and Addicts in Need, which opened in 2009. He is proud to be in recovery since 2001. He opened a multi-facility recovery and treatment center, New Perceptions North, in 2020. Fresno Police Chief Paco Valderrama is the city's 23rd police chief. He is a 28-year veteran of law enforcement, a graduate of the FBI National Academy, and a member of the California Police Chiefs Association. Detective Dino Cardinale has been with Fresno Police for almost 27 years. He is one of the founding members of the Fentanyl Overdose Resolution Team, also known as FORT. He is a subject matter expert on fentanyl overdose investigations and fentanyl distribution cases. Dr. Michelle Cantwell-Kofer is the Fresno County Superintendent of Schools. Now, Dr. Kofer believes that we must be committed to the success of the whole child, starting with healthy families and early care. And she feels it's important that children must feel safe and valued in school. And Dr. Herbert Cruz is the medical director for West Care, California. Dr. Cruz is certified in addiction psychiatry. He is the previous medical director for Tulare County, Merced County, and Madera County, and also worked for Fresno and Kings counties. And joining us remotely tonight is Assemblymember Esmeralda Soria. She represents the 27th Assembly District, which includes parts of Fresno, Madera, and Merced counties. She is also the author of Assembly Bill 675, which prohibit the possession of fentanyl and a loaded firearm. We thank you so much for your time and really giving of your expertise to this very important topic. Flint, we're going to start with you. Simplest question of all. We've done this before. What is fentanyl? What forms do people find it in?
Well, thank you for having me. Fentanyl is a synthetic opioid that is 50 to 100 times stronger than morphine. The ways that it comes in a patch. It comes in powder form. It comes, and what I mean by a patch is it goes to the skin, then the medication goes directly through the skin into the body. It's also in pill form. It's an injectable, and of course, now it's in nasal sprays as well. So it comes in a variety of different forms.
Dr. Cruz, some people might hear the term fentanyl and be in the hospital and think they want to give me fentanyl. What is this about? There is a difference between medical grade fentanyl and illicit fentanyl, if you can explain that to me.
Absolutely. The illegal fentanyl that is coming into the United States is primarily produced by precursors that are manufactured in China, that are either put together in China or put together in Mexico and then smuggled into the United States. They differ tremendously from pharmaceutical grade fentanyl insofar as the dosing is different, the adulterants are different, and sometimes many of the precursor agents and precursor drugs that go into the manufacture, which are in and of themselves quite toxic, remain in the fentanyl that is being sold as illicit fentanyl.
And again, talking about sometimes it's found in painkillers that are sold on the street. How can you tell if something is laced? We were talking about this earlier just today. LA Times had a write-up that even in resort towns in Mexico that are popular with tourists, pharmacies are selling Percocet, other drugs that would have legitimately been purchased, but are actually laced with fentanyl. Is there a way to tell the difference?
About one of the only ways would be to use a fentanyl test kit. These are available and they cost anywhere from $1 to $2 each so that you can test whatever product you're purchasing. However, probably the best way is to obtain the medications for pain management and analgesia from a pharmacy through a physician locally. Going somewhere else to buy pain medications is probably not the best way to go in 2023.
Chief Valderrama, what are your investigators learning about where the fentanyl is coming from? I know he mentioned precursors, China, Mexico, but here in the Valley, where are we finding?
Well, it's very simple here in the Valley. It's coming through the San Diego border. And as Dr. Cruz mentioned earlier, yes, the precursors are coming from overseas. So now we know that India is also a big smuggler of the precursors. You know, it's a very sophisticated business plan. And the precursors are smuggled into Mexico. They're put together into pill form or whatever form they're going to smuggle in. And then the cartels are smuggling them in through the southern border, either El Paso, San Diego, you know, other places along the border. And they make it to our streets. So it really doesn't take very long, but it is a very complex and frankly, a very lucrative business plan for them.
Detective Cardinale, you're the expert in this. Why is this so accessible? Why is it so addictive? Is it just because it's cheap?
Yeah, it's cheap. There's so much of it on the streets. These pills are going from anywhere from $8 to $10 a pill. When we first started seeing here in Fresno, it's going about $20 to $25 a pill. So they're actually decreasing the price because now we have full-blown fentanyl addicts, and they're decreasing the price so it makes it more available for them to get it.
Okay, well, not all the news is bad news when it comes to this topic, in that law enforcement agencies are seeing progress on the fentanyl front, as you all well know. Two of you definitely. The Fresno County Sheriff's Office says that it has seen major progress on this. Fentanyl-related deaths were down 9% in 2022 compared to the meteoric 178% increase in 2021. So far this year, it's seen 29 fentanyl-related deaths. Fresno police responded to 50 fentanyl overdoses last fiscal year, made 20 arrests, recovered over 150,000 pills, over 6 pounds of fentanyl powder, and seized over 25 firearms. So, Chief and Detective Cardinale, I don't know whoever wants to go first. If you want to go by rank, by all means. What seems to be working, what's being done right, and what's changing?
That's usually the way it works, by rank. But, you know, and I don't want to be pessimistic, but I am a realist. And the fact that these overdoses have gone down, I believe, has a lot to do with the public service announcements, with the education, with parents getting more involved, with the fact that, you know, these kids that are using are doing it, they're using the buddy system. And Narcan, the availability of Narcan, the fact that it's gone up, that's why I believe that these overdoses have gone down. Is there less or is there more fentanyl getting through our borders? I'd say significantly more. So that's the scary part of it. Even the whole business plan that I talked about, and Detective Cardinale mentioned that at one point fentanyl pills here were $25. Now they're $8. You know why? Because there's more of them. Okay, I was with the San Diego chief, Chief Neslight, just last week at a conference. So they're going for 75 cents in San Diego. Why? Because it's at the border. But yet you go to Alaska and they're going for $90 a pill. And why is it so prevalent? Because it's so profitable. Think about that, 150,000 pills recovered at $90 a pop. So the business plan starts out like this. Once you smuggle them across the border, every mile that goes away from the border is a risk for these cartels. So that's why it's more and more and more the further north you get.
Detective Cardinale, anything else you want to add?
And I truly believe that the form of the 14 team, the fentanyl overdose resolution team back in 2020 had a big part of it. Not only putting a team together like myself and our team, the United States Attorney's Office, the District Attorney's Office, our chief committed to this plan here, and just getting out there and educating the public. Our team does at least 2 educational presentations a week, if not at schools. I was at Valley Children's Hospital yesterday doing a presentation, getting the word out, trying to slow down the momentum of these overdoses. And we knew right from the get-go, that we wouldn't be able to prosecute a way out of this. And we knew we had to have a strong educational program, and getting out there and educating the public and starting in the middle schools and high schools is very important.
A Ford team, which Assemblymember Jim Patterson sang the praises of the team during a task force hearing just last month. Speaking of Sacramento, we're going to check in with FOX26 anchor Monty Torres, who has Assemblymember Esmeralda Soria with us live from Sacramento. Monty?
Thank you, Liz. And Assemblymember Soria, thank you for joining us. Before I get into a direct question to you, I'd like to ask you, you've been listening to our town hall, heard it from our panelists. Is there anything you've heard them say that you would like to expand upon or reply to at this point?
Well, first and foremost, I want to thank our law enforcement officials for the incredible work that they've been doing in tackling this issue. I think, we realize that we all have to work together, one, to educate the community, to ensure that parents are knowledgeable about the dangers of this drug and how easily accessible it is to our young children. It is a crisis that we have at hand, both a public health crisis and a public safety crisis. And so I'm just proud of the work that they've done. Just recently in Merced County as well, our law enforcement partners with the Department of Justice announced a seizure of 40 pounds of fentanyl powder and also 58,000 fentanyl pills that were worth millions of dollars and took them off the street. And so I'm incredibly proud of the work that has been done, but it is going to take action from our state partners to continue to tackle this incredible issue that we are in a crisis currently, not just in the Central Valley, but in the entire state of California. And so I'm looking forward to doing the hard work in Sacramento to ensure not only that we're educating the public and that we have those resources available, but that we're passing policy that is really going to hold those folks accountable as well.
Speaking of that work in Sacramento, you recently introduced Assembly Bill 675 this year, February. Can you tell us a little bit about what brought this about, what it would do, and what its status is right now?
Yeah, so AB 675 was one of the bills that I first introduced because this issue, when I was running for office, was on the top of the mind of many, residents that I spoke to in the various town halls. And so what this bill would do was very simply clarify that if you were caught by law enforcement with a loaded firearm and you had fentanyl, that you would be charged with felony. Existing law on the books state that possession of any amount of a substance abuse containing, cocaine, methamphetamine, or PCP while armed with a firearm was a felony. And so I believe that is 50 times more dangerous. It was important to also include it in this list of drugs. And so that's what the goal of AB 675 is to ensure that we're including that. Unfortunately, the bill got stuck in Assembly Appropriations. We were able to get it out of Public Safety, and so it did not get it out of Assembly Appropriations. However, there is a companion legislation by Senator Alvarado Gil that is very similar that did pass the Senate and the Senate floor. So it is coming back to the Assembly. So I'm working really hard with her as a co-author to ensure that we can get it through the Assembly process and get it to the governor's desk. Our goal is to ensure, again, that this is stated clearly in the law so that we are holding those folks accountable.
Thank you, Assemblymember Soria. We will check in with you again shortly for some more questions. Liz?
All right, thank you so much, Monty. Okay, before we go to break, it is summer. Dr. Kofer, why is it so important for parents to be aware of their child's cell phone activity, cell phone apps, since they're spending so much time at home when there's less supervision?
Right. You said the key term, supervision. Our students have some idle time, perhaps, and we want to make sure we're channeling their time into productive opportunities. And unfortunately, time spent online with their phones is one of the predominant ways that drug dealers access our students, our children, our teenagers. So parents need to check in on who's on their children's phones, who they're talking to, what they're doing with their idle time, and just be very aware of how to keep their children safe.
Detective Cardinelli, you were telling me during a presentation, some parents said, we didn't know we could check our kids' phones.
I was doing a presentation at one of the outlying schools, and one of the parents asked, "Hey, can can I take my child's cell phone away
Can
from?
I legally take my child's cell phone
take
away?
my child's cell phone away, because these kids were telling their parents that if they took their cell phone away, they would call the police on them. That was like stealing their phone. And I said, you could check their phone anytime you would like. And I encourage you to do that.
And those parents, you were telling me there was a bit of a language barrier for some of them who didn't understand what their rights were.
Absolutely.
Así es que si sus niños no quieren permitir que fijen en los teléfonos, tienen todo el permiso en el mundo de acuerdo al detective. No les hagan caso si los niños dicen que no pueden fijarse en los teléfonos. Well, it is now time for a break. Coming up in our next segment, we're going to dive deeper into the laws about fentanyl and challenges in Sacramento. It's something that we've been covering extensively. And here's how one dad shared his outrage over this issue just last week.
And it's unfathomable for me to be standing here right now, nearly 4 years later, and not a damn thing has been done. I'm not a Democrat, and I'm not a Republican. I'm a dad who lost a daughter.
And a law is now proposed in his daughter's name. We're going to talk about that after the break.
You're watching Fox 26's Town Hall. Your voice, your future. Fighting fentanyl. We'll be right back. Welcome back to Fox 26's Town Hall. Your voice, your future. Fighting fentanyl.
We've submerged our culture with drugs, but where is the access to treatment for our people?
Yes.
We have given children access to a lot of high THC potency that's out the window compared to what it was. Where's the treatment? How did we open up the floodgates for everyone to have drugs, but we didn't open up the floodgates for treatment? This is absolutely our fault.
Thank you. Welcome back. That was Assemblymember Dr. Jasmine Baines of Delano, who also is a board-certified addiction doctor. Again, a member of the Assembly. This was during a hearing on fentanyl, the fentanyl and overdose crisis. As you heard her there expressing her frustration with her colleagues, and you heard her say there, this is absolutely our fault. Just before the break, we heard from Matt Capilouto, who is the father of Alexandra Capilouto, who is the namesake for Alexandra's Law. Just last week, Assembly Republicans and a handful of Democrats kicked off the campaign for a constitutional amendment known as Alexandra's Law. It would require those convicted of a fentanyl-related offense to receive written notice that if someone were to die as a direct consequence of their crime, they can be charged with homicide. District Attorney Ward, thank you for joining us. This is similar to the notice that's given to drunk drivers already, right?
Exactly. You'll often hear it called a Watson admonishment, and that's a legal term for what we're doing with DUI cases. And what's really sad, another tragedy here, is the reason why you're hearing legislatures have to take it in an initiative is Senator Tom Umberg put forward a bill with a plethora of support from both sides across the aisle. Alexander's bill, SB 44. The tragedy of Sacramento is it failed twice to even get out of Senate Public Safety. So the members of the legislature weren't even able to vote on that. What's frustrating, as you've heard, fentanyl is a new tragedy that's befallen the criminal justice system. So the justice system and the laws on the books right now are not geared to address fentanyl. Assemblywoman Soria's bill talking about the need for more punishment when you have a firearm. We have that for the other hard drugs, but we don't have it for fentanyl. There's no additional punishment for having excess weight for fentanyl. We have that for other bills. Fortunately, there's a bill on that topic that's still alive. But SB 44, Alexander's Law, failed. Another bill has failed, and that would simply allow prosecutors across the state to increase punishment when a dealer knowingly deals and furnishes fentanyl to someone. They take it and they suffer serious bodily injury, but short of death. The legislatures failed to even take action and give us more tools to handle those. So that's what's frustrating from our side.
Flint, you were up there for the announcement of this push for Alexander's Law. The proposal at face value doesn't seem like an immediate punishment. You've been there for hearing after hearing. How receptive do you feel that lawmakers have been to your plight and the plights of families who've lost loved ones to this crisis?
They haven't been there at all. That's the God's honest truth. They literally sit there and they will say that they feel for the parent, especially the parent that lost a child, but then they will come back and say and ask the question, does it really make any difference if we put this person in prison or not? And as I'm sitting there listening to this, they might as well slap every parent in the face that has lost a child to this horrific epidemic that we've got going on. One assembly person up there simply said, I cannot believe that drug dealers are lacing every pill with fentanyl. They don't have a clue on what is going on in the street. They have no idea what's going on in treatment. They have no idea what's going about what an addict goes through. They don't have a clue on anything. So again, the short answer is no. They simply don't care. That's the message they're getting across.
Moments ago, we heard Dr. Baines talking about opening the floodgates to access to medications. Let's take a look at some figures that DA Ward's office shared with us that tie in with what we heard moments ago. According to the California Department of Public Health, Tulare County suffered 57 opioid-related deaths in 2021, which is the latest figures available. In that year, more than 220,000 prescriptions were written for patients in Tulare County. So, DA Ward, what challenges do you face when it comes to laws related to sales and distribution? Do you feel you have the tools to adequately address that problem?
Absolutely not. And I don't speak just for me, for prosecutors across the state. So there is all of this focus on changing some laws going forward and bringing what I'll say is parity, treating fentanyl with other drugs. But the hypocrisy and what needs to happen here is we've got to look at the complete failure of the criminal justice system as how it's treated addicts recently. And what I mean by that is we recently had a case, everyone's talked about it, law enforcement here in Fresno sees the same thing. A person can be arrested for transporting 150,000 fentanyl pills. They're arrested, they are prosecuted, they are punished, and they are sent to quote-unquote county jail now, county prison after AB 109. Yeah. And because of the mandates around the state, our sheriffs have an impossible burden with their jails, and quite often those sentenced individuals are walking right out. The aspect of treatment as a component of that, it's a lie, and we need to wake up and recognize for what it is. Even if we punish fentanyl dealers right now to the maximum sentence, there are jails around the state that are so overcrowded because of AB 109, that individual is going to walk right out. And the criminals know it. Chief can tell you that.
To what extent do you feel that you're having to rely on your federal partners? I know that that's something we've heard time and again from Fresno County DA Lisa Smitkamp.
We are incredibly lucky here in the Valley to have a very good relationship with our federal partners in the U.S. Attorney's Office and working collaboratively with them. There are times when their laws have, I'll just speak frankly, their laws have a more authentic punishment. Not just a number and ink on paper. And we're very fortunate that our law enforcement really do the brunt of the work coordinating with that. But there are times when we will gladly allow the U.S. Attorney's Office to step in and take over a case because there's meaningful punishment. And if there's meaningful punishment, there's the opportunity, and I'll use the analogy of the carrot and the stick, for then meaningful treatment and rehabilitation, which all of us, the district attorneys around the state, we're for that.
Okay. Chief, we've heard you say time and again there's a lack of legal support.
Yeah, and I'm glad I'm going next because I have some points to make that are, rather simplistic. But if we look at this issue just from a national standpoint, and everybody has an opinion, especially when you get into politics, whether you're left or right or blue or red. But let's just look at the numbers. And we don't have the stats for last year, but the year before, over 100,000 people died of overdoses. I mean, over 100,000 people. I think it was 104,000 people died of overdoses. Well, every year, roughly between 30 and 40,000 people are murdered. So we watch the evening news and we make a big deal about a bad weekend in Chicago and the murders and the mass shootings. Hold on a second. That's a fraction. That's a fraction of the people that are dying of overdoses. Similar to traffic fatalities. Traffic fatalities, between 30 and 40,000 a year. But yet, still a fraction of the people who are dying from drug overdoses. So with traffic fatalities, we can step up our efforts. We can be proactive. We can write more citations, and we can actually lower that number. Same with violent crime. We've done it here in the Valley. The last year, we focus on gangs and guns and take guns off the streets, take violent criminals off the streets, and we actually lower the homicide rate. What can we do when the laws are not in our favor? What can we do when, and no one's advocating, as the district attorney just said, no one's advocating that we don't want to get sick people, drug addicts some help. We should. That's why there's, people like Flint who have services that can give people the help that they need. There's not enough of them, but they can get the help that they need. We're not advocating for that. What we're advocating is for consequences, serious and just consequences for the cartels, for the people who are bringing the poison into our community and killing our kids. And, it's like as a police chief, hey, we want you to lower crime, but we don't want you to send anybody to prison. We want you to, make a change here, but we're not going to help you, by enacting laws that are going to help you. What we need is accountability. When you have accountability, when you have consequences, then you can put it on me to make a difference. Until then, we're really kind of spinning our wheels.
And speaking of laws, we're going to check back in with FOX26 News anchor Monty Torres with Assembly Member. Okay. We're just going to continue the conversation then over here. I was just told to continue it here. Growing debate over the issue. There's been a growing debate over the issue of harm reduction. That's become a catchphrase in Sacramento, harm reduction, with supporters saying criminalization has backfired, made things worse. The National Harm Reduction Coalition calls on people to consider illicit drug use as part of our world and chooses to minimize its efforts rather than ignore or condemn them. Calls for non-coercive provision of services and resources to people who use drugs, and acknowledges that some ways of using drugs are safer than others. Public health experts have even gone on the record saying that harsher sentences for fentanyl convictions can actually keep people from calling 911 out of fear. So, Flint, Detective Cardinale, Chief, if you want to chime in, whoever, what goes through your mind when you hear this, since you're fighting to get these drugs off the streets? Does it sound like just giving up on the war on drugs? And should punishment be abandoned altogether? Dr. Cruz, if you want to any of you want to chime in.
First of all, if you don't mind, look, I am dead set against long-term harm reduction. And I think people need to understand the difference between short-term harm reduction and long-term harm reduction. And harm reduction, to me, is putting somebody, once we get them into treatment, is to actually getting them on a medication that can help them detox properly within about a 30 to 40-day period without them going through major withdrawal symptoms. The problem here is that there's a lot of people out there that want to keep people on drugs like Suboxone and methadone. And all we're doing, I've been on methadone. I know what it's like. It takes forever to get off of that drug. This is not going to solve our problem here. It is just simply not. Again, it's the devil on one shoulder, the angel on the other when you're talking about fentanyl test strips. Is it okay to tell a 14-year-old on a Friday night, mom and dad, that, hey, son, we know you're going to do your cocaine tonight, all right, but here's a fentanyl test strip because we don't want you to die? I mean, that's the argument. So, again, long-term drug use, safe site injections, instead of putting those in play, why don't we put the monies allocated into other treatment facilities? Because our treatment system is broken at this point.
When I hear harm reduction, I think of San Francisco because that's something that seems to be very popular. Chief, I see you perked up.
Yeah, you know, and my response was going to be, and I don't mean to be facetious, but how's that working out for you? You know, look at the numbers. You know, you look at a city, a beautiful city like San Francisco, and look at what happens there, what has happened there in the last 10 years. And that's my question, how is that working? And the fact of the matter is not. And I think, you know, part of the harm reduction is that there's an assumption or a philosophy that if you legalize everything, that all of a sudden, you know, or decriminalize crime, that all of a sudden it's going to go away. No, just because you decriminalize crime doesn't make it go away. It's still there, and it's harming our community, and it's creating drug addicts, and it's you know, making the situation much worse. So that's not working. We need more treatment. We need accountability, and we need it now.
Detective Cardinale or Dr. Cruz?
Yeah, when we go after these scenes, we are not going after the fentanyl addicts. We are going after the people that are providing this poison to the victims that are overdosing off this stuff. The people that we are arresting are not the addicts. When we go to these scenes, we're educating the parents, the kids that have overdosed on this stuff to try to get them off of fentanyl.
Okay. Flint, I know that there's been some frustration. Changes you want to see Sacramento to address when it comes to PPO coverage. You were saying that there's been an issue with some insurances that are not, and this is stuff that Sacramento could help out with, that insurances are actually lengthening the amount of time that they're willing to cover on some treatments?
Yes. In fact, look, treatment is split. This is my opinion. The treatment is split into two different sections. And I hate to put it this way, but it's the truth. It's people that can afford to pay a cash price to a treatment center and people that have PPO insurance. Or it is individuals that do not have the ability to pay a cash price, or they have an insurance like a Medi-Cal, which most private treatment centers don't take simply because we are not paid enough money to even keep our doors open with the amount of money that they're allowing for us. PPO insurance companies right now are actually reducing the amount of time that people stay in treatment. We're seeing an average now of 17 to 23 days. And until Sacramento understands, until the insurance companies understand that addiction is as much behavioral as it is everything else, you don't change anything in 17 days or 23 days. You don't change anything in 60 days or 90 days. That 90-day mark has to be the minimum amount of time. And if insurance companies take any more time in reimbursing treatment centers, I don't know what we're going to do, because that has slowed up as well. So the treatment industry is getting hammered from all different sides. And again, until Sacramento deals with the insurance companies, fights their lobbyists in some fashion, I just don't see a change coming here. And it's going to get worse for the addict out there.
Dr. Cruz, you also?
I agree completely with what has just been said insofar as the length of stays have been pressured to be decreased. And in fact, even Medi-Cal programs that at one time saw average length of stays in things called therapeutic communities between 60 and 90 days are now being told that 30 to 60 days is the maximum amount of days. We are dealing with a new drug and a new set of moralities associated with that drug that requires a longer period of time. It's very important to put it in perspective that it takes only 2 milligrams of fentanyl to kill someone. That's the equivalent of 3 grains of sugar. Yeah. As much fentanyl has been seized by the California law enforcement that would kill the entire population of North America twice over. And so when we come to looking at treatment, there has to be a re-envisionment of what we're looking at. This isn't treating marijuana. This isn't treating alcoholics. This is treating individuals that at every use, even if they're using another drug, can be exposed to fentanyl and as a result die. There is opiate monies that are coming out there, but they're being earmarked for only opiate treatment, and yet we're finding this very deadly synthetic opiate in marijuana, in Xanax, in cocaine, in methamphetamine.
We're going to talk more about, I'm sorry to interrupt you there, but they're telling me we've got to go to break, so it's time for another break. But speaking of treatment, we're going to be talking about that coming up in the next segment, when it's time to reach out for help, what is access like, and how to get your hands on life-saving medication in the event of an overdose. We'll be right back to continue the conversation.
You're watching Fox 26's Town Hall. Your voice, your future. Fighting fentanyl. We'll be right back. Welcome back to Fox 26's Town Hall. Your voice, your future. Fighting fentanyl.
I think the most fundamental thing we need to do to make the quality of addiction care better is to move it boldly into the rest of the healthcare system. It sort of exists out there as a country cousin. You know, it's sort of less connected, less resourced, less prestigious, stigmatized. And if we did that with cancer care, there would be riots. And so we just need to bite that bullet and say, this needs to be a part of how the healthcare system works.
What you just heard there was a plea of sorts to improve addiction care. There is no denying there's a stigma there. Work continues to end that stigma, but that work oftentimes begins with families. Dr. Kofer, I want to ask you, are there any resources for families who suspect that their child may be experimenting, and sometimes their first point of contact to seek out that help is at school sites? Any help that they can get at school sites?
Yes, absolutely. We have partnerships with the Department of Behavioral Health with Fresno County, and we have a program called All for Youth in every one of our schools. It's a simple call for help, and parents can call, teachers can refer, and we have a medical clinician at every site.
All right. Dr. Cruz, again, that one we will be providing a link for that if parents want to have any more information on our website at KMPH.com. Dr. Cruz, at what point should family members seek help for their loved ones who may be abusing opioids, and are there any signs to look for?
There's a simple answer to that, which is where there's smoke, there's fire. Anytime you suspect anything, you should get involved, have a discussion with a family member, have a discussion with friends. As was mentioned, check their phones. The availability is so broad and great that it's important for any family member that at any time suspects something, that they see things such as decrease in hygiene, less interest, changes in personality. One of the really key hallmarks for opiate-specific use is pinpoint pupils. This is Fresno. We have sun 288 days out of the year. If you have pinpoint pupils in Fresno, there's a pretty good chance that you've had access to opiates in one form or another.
That's a very easy way
Pretty easy way to look. Yes. And it's important to maintain, as was mentioned earlier, the lifeline of communication, but not just communication with your child, communication with their school, communication with their friends, communication with other individuals that might have an inkling that there's a change that might be an indicator. Because even if you're wrong, and it isn't an indicator of substance abuse, it might be an indicator that there's a mental health problem. It might be an indicator that there's an academic problem, that there's bullying going on, that they've been exposed to trauma at some point. Changes in personality are things that children typically do not undergo during the school age years. And as a result, when you see any stark changes, one has to take notice and intervene.
Okay, we're going to check back in with Fox 26 News anchor Monty Torres, who's got Assemblymember Esmeralda Soria with us live. Monty?
Thank you, Liz. Assemblymember Soria, thank you for joining us again. We talked earlier about Assembly Bill 675, your bill, and that it was stalled in committee. Now, at the same time that happened, AB 367 and AB 1058, bills that would have added sentencing enhancements and stiffer penalties to those who have large quantities or deal in fentanyl, were killed by the Assembly Public Safety Committee. At a time when fentanyl is raging as an epidemic in our country, why do some of your colleagues say they will not support fentanyl legislation calling for stiffer penalties? Can you help us understand that?
Yeah, unfortunately, I have to disagree with some of those colleagues. I have been very supportive of looking at stiffer penalties on this issue because we know that we have an epidemic on our hands. There are some legislation that is still moving forward, like AB 701 by Assemblymember Villapurua, which would also add enhanced penalties for a large quantity of fentanyl possession. And so we're going to continue to support those efforts. But most importantly, we have to continue to support other policies that will help with the education, will help with the treatment. There are numerous legislative proposals that have bipartisan support, one being authored by Assemblymember Joe Patterson that makes Narcan readily available in schools. As you guys are hearing from our education leaders, this is a big issue in our school systems. And so we want to make sure that this life-saving drug is also available. So we have to look at all the different policy considerations and the issues to address the crisis that is in front of us.
Well, lawmakers in Sacramento are important allies in this fight. We certainly hope your colleagues can see things the same way you do on this matter. Liz?
Yeah.
All right, thank you so much, Monty. So, Flint, we were talking before the town hall, just some prep work here, and you were telling me point blank, the treatment system is broken. Are there enough resources? What is treatment like now? And again, what role do insurances play in this?
Yeah, let me start with this. Look, addiction is not an 8 to 5 ordeal. It is 24 hours a day, 7 days a week, 365 days a year, period. We have to start answering our phones here. And what I'm talking about, and again, this may not be a very popular statement, but our county programs and some of our treatment centers they have to answer their phones after hours. If there's an addict on the other end of that phone that wants treatment, that needs it right then and there, they're not going to wait to go through 17 voicemails before they get somebody's help. I've called all of these numbers around the country, and it's all the same relayed message. And there's not even one voice in there that's saying, are you seeking inpatient detox help? Now, the private side, yes, that's what we do, and we answer it. I really wish that our county programs, which are good programs, would work with us private treatment folks to come together to get some sort of resolution here on how we're going to get these people that help. Because if we keep going the way we're going, we're losing more people, I think, due to the lack that we don't have the treatment available for them. So this thing is a huge problem that needs to be revamped, starting right at the beginning again. And again, the insurance companies, they are not helping this cause at all. Not at all. And I don't know what else to do. I mean, we try to battle the insurance companies. We try to get our point across, but they simply don't care either. So it has to be the lawmakers coming down and getting some decisions made here. And because if not, we've already lost a generation of kids, in my opinion. We're going to continue to lose another generation. if we're not careful. Because again, people need to realize this as well. This is from people's lips to my ears. When these kids have overdosed, and I'm talking about 14 to 25-year-olds, when they have overdosed and lived, and by the way, we're not talking a lot about those folks. We're not talking about the thousands that have overdosed and survived it. Every question that has been asked of these individuals, did you know what you were buying? This is very important. Did you know what you were buying? And every one of those responses was, yes, I knew it was fentanyl. The follow-up question is, did you know you could die from using fentanyl? Every answer was, yes, I know. People have to understand the addict and where we're coming from. That is so key in this. For everybody, from law enforcement to the medical community to treatment, everybody has to understand the addict if we're going to give that addict the help that they need. Because it is a long fight.
Dr. Cruz, I see you ready to chime in as well.
If I can add, there's a very prominent researcher by the name of Dr. Fiore that published some very seminal research where he showed that whenever someone asks for treatment is the time to intervene. And the first model and research that he did was people that were in treatment for substance use disorders that asked if they could stop smoking. And the physicians were saying, well, no, your plate is already full. Well, let's tackle smoking later on. What the research showed was that those that actually did quit smoking had better outcomes. And so I agree that when someone that is suffering from an opiate use disorder or any substance use disorder is requesting treatment, we need to offer them treatment. And the difference is that we often define terminology different. In my treatment world, harm reduction doesn't mean having someone on methadone for 35 years. In my world, harm reduction is someone comes in and says, I've got to get off this fentanyl, I almost died from it, but I'm scared to, can I get some buprenorphine? And we will say, in one of our medication assistant treatment programs at West Care and other places, we will say, yeah, let's start you there. And that's the entryway into recovery. Because at least then you're not going to die. But it's never our intent to keep them on that forever. And so again, we define harm reduction very differently amongst us.
And I agree with Dr. Cruz. Just one more statement I would like to make. When that addict is looking for treatment and for help, 99% of the time it's one reason: they are going through withdrawal symptoms. And there is nothing worse on this planet than somebody going through an opioid withdrawal.
We heard that from the young man during the last town hall who was talking to us about that. We heard that also in the open to tonight's town hall. As we go to break, we're going to hear from another parent who lost a child to fentanyl poisoning and take a look at how easy it is to access these pills.
It wasn't until we were able to open his phone the next day that we were able to put the pieces together of those fateful last 2 days of his life. Zach purchased what was being marketed as a Percocet pill. A dealer was operating on Snapchat, putting up menus of these drugs.
Menus like the one you see there on your screen. These include emojis rather than words to fly under the radar. This was a graphic that I was actually able to find on the office of the Fresno County Superintendent of Schools, provided by the DEA. The symbols look harmless. I mean, we're talking candy bars, cookies, baby bottles, grapes. Those could all lead to deadly consequences. According to the DEA, 6 of 10 fentanyl-laced fake prescription pills contained a potentially deadly dose of fentanyl. That graphic we will be providing for you as well over on KMPH.com. We'll be right back.
You're watching Fox 26's Town Hall. Your voice, your future. Fighting fentanyl. We'll be right back.
They're both good.
Welcome back to Fox 26's Town Hall. Your voice, your future, fighting fentanyl.
While we're here talking about fentanyl and opioids, there's an emerging benzodiazepine that are killing people right now. So as we are very trying to get Narcan into schools, we got to get ready for what's about to happen when this high potency benzo hits our schools. That's a reality. What, are we going to keep having these committee meetings every single 6 months when a new drug emerges? The reality of what's happening is we're losing our war on drugs.
Thank you. We certainly are not going down without a fight tonight. We're hoping to give you the tools to empower you as parents and concerned community members. With that in mind, Detective Cardinale, we addressed the concern that was raised by Assemblymember Baines. What is the next drug that you see posing a threat? We heard her mention benzo. Trank is another one that we've heard thrown around.
I mean, fentanyl is not going anywhere. That's here to stay. So it's always going to be an issue. Fentanyl. As far as the benzodiazepines or the Xanax or the alprazolam, every case that we've been out on, when it involves a child, a juvenile, a kid, we notice that how they start with the progression of using fentanyl is always marijuana. It's always vape pens. It's always wax pens. And what happens with that is there's so much THC in the wax pens, the marijuana today, the weed pens, that it causes anxiety in our kids. And the next way to control the anxiety is
Cancel one out with the other.
Is Xanax. And all the kids that we've spoke to that have survived overdoses, that was the progression. Marijuana, Xanax, and fentanyl pills, fentanyl-laced M30 pills. And to kind of hit on the M30 pills, I can tell you that all the M30 pills that we've seized here in Fresno, not one has not contained fentanyl or a deadly amount of fentanyl. And as far as the test strips are concerned, you can get an M30 pill and think that you're going to test these M30 pills, but what if you hit a portion of that pill that does not have fentanyl in it? And you have this misinformation, oh, this pill's safe. These pills are made in clandestine labs in jungles in Mexico. There's no quality assurance with these pills. So you can take a portion of that pill and might not pop hot for fentanyl, take that fentanyl pill and wind up overdosing and dying.
We're going to check back in with Fox 26 News anchor Monty Torres with a look at what you're saying about this issue. Monty?
The questions we received tonight, two particularly struck home that I want to leave with you and your panelists. One, Fox 26 viewer Kelly Maccabee says her son overdosed on fentanyl but was saved by Narcan. She asks, how does one inform law enforcement of a known residence that sells fentanyl? And two, the second question, an anonymous viewer says, now that Nuestra Casa is closed, where can we send our Spanish-speaking family member needing residential treatment? Liz?
Okay, we're going to start with the first question. If you know of a stash house, at one point there was a Crime Stoppers reward. Is that still active?
That is still active, so you can call Crime Stoppers. You can actually send us a tip on social media now. You know, we have a full-time office that, although we don't monitor those 24/7, every day they get looked at. So those tips can be simply forwarded to the investigative unit that's going to look into that case.
Okay.
And you can send your tips in Spanish as well.
All right, 559-498-STOP. That's 498-7867. We show you every night. Dr. Cruz, we mentioned the question of, is there help available in different languages?
Yes, there is. Because Spanish is a threshold language in the county of Fresno, all providers are required to be able to offer translations. We also have an agency, the Fresno County Hispanic Commission, that is able to provide residential treatment for individuals that require such treatment. It is a relatively small program, and actually right now they're closed because they recently had a fire. However, they're looking to reopen. Places like West Care Kingsview, other organizations, New Perceptions, etc., are able to offer services in multiple languages as well.
Okay, I've been told we have 3 minutes, but I want to show this. This is Narcan. This is what we've been talking about. Flint, how can people get a hold of this? It costs, but you guys give it for free.
Absolutely. The pain organization, Parents and Addicts in Need, all you have to do is call us, come on in, we'll show you how to use it, and we'll supply you with that Narcan. If you had to go and buy it right now, I believe Walgreens is $100 to buy it. I believe there are some other places where you can buy it for $70 or $45, but we give it away for free. And we supply quite a bit of people in the Fresno and the Valley. So come on in and we'll give it to you.
All right, I'm being told we've got maybe roughly 2 minutes left, so I'm just going to check in with each of you. Some final closing thoughts. We'll start with you, DA Ward, and just go down the line.
Well, I think we've heard enough to realize that the aspect of the state and the administration's perspective on this topic, it's a failed experiment that's being borne on the back of families, and our children are paying the price. It's time to act. We need meaningful laws on the book. Prosecutors need the ability to hold those that distribute this poison accountable and convict them of murder, which is the crime that they are committing. I think we need to look backwards in time. We need to look at AB 109. We've got to give our sheriffs control of our jails back. They are in the best position to manage their population, and they should do it because they are more than adequately qualified. But right now, we're all hamstrung. It is a major problem. I have a daughter. This scares me what I hear. But the good news is, at least here in the Valley, we've got a good partnership, but we need our leaders to step up and give us the tools that we can do our job with.
Okay, we've got about a minute left. Anybody else wanting to say anything else?
I take this part.
Actually, it's coming here from Dr. Kofer.
Just an invitation for parents to go back to the old-fashioned practice of talking to your kids, spending time with your kids. Take those phones away from your kids. Spend time. Invest time in your kids.
Okay.
I just want to touch on that real quick. Yeah, be in your kids' lives. Check their social media. If they're going to have social media accounts like Snapchat, Instagram, know who their friends are. You're going to see the warning signs.
My apologies.
I do want to very quickly acknowledge our Fresno County Sheriff, John Zanoni, who is here in the audience. He's been a panelist on this very previous times before. And I want to echo something that DA Tim Ward said earlier. We're doing it very well here in the Valley, and it's because of these partnerships, not just with our Fox affiliate, who always gives us the time, but the fact that we communicate sometimes on a daily basis to address these issues is very important because we're doing it for our community.
Well, thank you all again so much for being part of this. And yeah, I did mention, my apologies, Sheriff Zanoni was also with us here in the audience. Once again, we want to thank our sponsors for making tonight's event possible. Dr. Ignacio Guzman, California Department of Healthcare Services, Sierra Meadows Behavioral Health, and West Care for bringing you tonight's town hall. We hope this conversation helped to educate and empower you, help our communities, and know what you want from your lawmakers. We'll see you tonight at 10.
Thank you for joining Fox 26's Town Hall. Your voice, your future. Fighting fentanyl.